Hello all, I am Dr. Sudipto Chakraborty. I am internal medicine postgraduate trainee from Apollo Multispecialty Hospital, Kolkata, India, and I am thankful to the organizers to present my case of glyphosate poisoning, who was treated successfully after application of HA230 Haemoadsorption cartridge. I was guided by my head of the department, Dr. Dhiman in every point of this case. So a quick introduction. So glyphosate is a non-selective broad-spectrum herbicide which is used around the world. Toxicity is mediated by uncoupling of oxidative phosphorylation and surfactant POEA, rather known as polyoxyethylene amine mediated cardiotoxicity. The symptoms are varied. The symptoms may range from asymptomatic to even death. There is no specific antidote for this poisoning. So, on the other hand, HA230 is a newer generation hemoabsorption filter cartridge, which is increasingly being used nowadays with newer hemoperfusion techniques being applied. So, jumping on onto the case, it was a 36-year-old lady who had presented in our emergency with alleged history of glyphosate herbicide ingestion 400 ml 18 hours back. She presented with cough, shortness of breath and disorientation for 2 hours. On further inquiry, she was found to be anuric for last 6 hours. Continuing on, we had a quick examination of her. She was conscious but disoriented. She had tachycardia, heart rate of 130 per minute. She had tachypnea uh, of respiratory rate of 30 per minute. She was also in shock of blood pressure 80 by 50 millimeter of mercury. Saturation was low in 94% in room air. In chest, bilateral basal crepitations were present. So we did a minor our emergency investigations. ECG showed, as you can see, white QRS complexes with right bundle Blashbrock pattern. ABG was done, which showed acidosis, pH of 7.2, type 2 respiratory failure of PO2 62, PCO2 47, slight hypernatremia with 144. Potassium was grossly raised to 7.1, which may be attributed to the changes in the ECG. Bicarbonate was low, chloride was roundabout normal, and lactose were traced. So it was a high anion gap metabolic acidosis along with the symptomatic hyperkalemia. Chest X-ray was also done, which was normal. Initially, we had started her on oxygen and bolus IV fluids, but after reviewing her ECG and ABG reports, we started her off on IV calcium gluconate and IV insulin dextrose and was kept on continuous monitoring. Other routine blood investigations were sent and repeat ECG was also done, which is now shown, which is normal, and she was shifted to an monitored bed. Continuing on, in the first 4 hours, her condition worsened. Her sensorium deteriorated. Shock was refractory to IV fluids, so she was initiated on IV noradrenaline, and antibiotics was also initiated with IV meropenem. She was intubated and put under mechanical ventilation, sedated and paralyzed. Serial ABG worsened with increasing acidosis, persistent hyperkalemia and anuria. There was no improvement, rather she was going downhill, and we feared the worst for this patient at that moment. Initial blood investigation that we had sent had come back by then. Total count was raised to 15,300, creatinine was raised to 2.3, sodium was 147, potassium 6.88, total bilirubin was 1.6, liver enzymes were raised, SGOT was 106, SGPT was 61, APTT 140, PT 22.9, INR was 1.68. The coagulation profile was also grossly deranged. Albumin was also low to 2.2. So, quick recapitulation of all the issues at hand at that present. At that moment, we had alleged glyphosate ingestion, cough with shortness of breath, altered mental status, anuria, tachycardia, tachypnea, shock, high anion gap metabolic acidosis with type 2 respiratory failure, hyperkalemia with ECG changes, leukocytosis, acute kidney injury, acute lung injury, and acute liver injury. So situation was quite bleak for the patient at that moment, and we were desperately searching for situations like what to do next for this patient, because by then we had seen many case reports and studies regarding this glyphosate poisoning, and we were not that hopeful. At the 5th hour of admission, we talked with the patient's family relatives, and we started her on continuous renal replacement therapy along with toxin removal Haemoadsorption cartridge HA230. We had counseled the family members regarding the cost, the mechanism of action of the cartridge, and we also told them that this is just a supportive most probably a supportive management, and we have to hope for the best. Initial 8 hours after starting, we did not have any positive response, but at the 12th hour of admission, that after 8 hours after starting it, her urine output started. In the next 12 hours, her ABG continued, her serial ABGs continued to improve with complete resolution of acidosis at the end of day 1. So how it is used? So as you can see, this is the CRRT machine, the conventional machine, and with that there is the filter, the conventional filter that we use in CRRT in its normal indications, and this is HA230 filter. Simply we had put the filter in this place instead of the conventional filter that we use for CRRT, and its use is very useful and easy, and could be done at any ICU setup if available. The CRT and HA230 if available, it can be done anywhere. So in the next 2 days, her sensorium improved and she was extubated. In fact, at within the next 24 hours of starting the CRRT, urine output and ABG normalized, and CRRT was discontinued at 36 hours of admission. So CRRT continued for around about 32 hours. Her BP was also normalized, and IV noradrenaline was discontinued. Repeat investigations showed improvement of total leukocyte count, liver function, renal function, and also her respiratory complaints was resolved. She was discharged. In fact, at the day 3 of admission, she went home walking on her own. So within 3 days, we had a dying patient with no solution in hand, and we started her off on CRRT and HA230, and at the end of the 3rd day she was completely fine, and in fact walked by herself and went home. So a quick discussion of our case. So glyphosate herbicide is available in market very easily. The agricultural use, we use 41% of concentrate and 1% is used for domestic use. Although traditionally it is not much toxicity, but studies have shown that ingestion of 85 ml of concentrated formulation can cause severe toxicity. Upon ingestion, it can be absorbed 30 to 36% systematically and reaches a maximum concentration at 6 hours. It can cause local and systematic symptoms. Local symptoms include the skin exposure symptoms like dermal irritation, oral or nasal irritation, tingling sensation. On ingestion, it can cause dysphagia, erosion, and bleeding. Severe manifestation can manifest as dehydration, hypotension, pneumonitis, oliguria, altered mental status, hepatic dysfunction, acidosis, acute renal failure with hyperkalemia, arrhythmias causing multi-organ failure. Although traditionally it is minimally toxic, but severe poisoning is refractory to most intensive supportive care. Uh, Previous studies have shown that pulmonary and renal toxicities are the main reasons of mortality. The triad of metabolic acidosis, hyperkalemia, and pulmonary edema has shown that outcome is grave even with early recognition, very aggressive treatment, supportive treatment. Uh, Upon previous glyphosate ingestion case studies that we came across, mostly were the outcome were grave. The patient did not survive, but there was one instance where the patient did survive. In that case, the patient was presented with 1 hour after ingestion and was treated with lipid emulsification intravenously, and she was on supportive treatment with regular dialysis, vasopressors, and respiratory supports. She made partial recovery and was discharged home after a prolonged hospital stay of 20 days with home supports. So very different presentation and outcome to our as compared to our case, because our patient presented much later than this case, and the outcome was completely different. Like our patient recovered within 3 days and made complete recovery, whereas this patient was discharged home after in fact 20 days. uh, Other case reports say that the patient did not survive at all. So completely contrasting evidence as per our case with respect to the previous literature that was accessible to us. And this HA230, 130 and 330 are newer hemoperfusion cartridges that have been developed in the field of extracorporeal blood purification technique in the 21st century. They have been mostly used in China and Far East, but uh, continued evidence favoring their use is increasing, and they are being used more and more. HA130 is used in CKD and in chronic dialysis patients where there are uremic symptoms, and they remove 5 to 30 kilodental molecules. HA230 is used in poisoning, and they remove molecules with molecular weight of 500 dalton to 10 kilodalton. HA330 is used in sepsis and in cytokine storm secondary to any rheumatological disorder, and they remove 10 to 60 kilodalton molecules. So in previous reports of HA230 use that we have come across, they have been used very effectively in China, Far East, and even in USA for organophosphate, paraquat, and daltemethrine poisonings. They have been shown to be far more effective as compared to the standard and conservative treatment. Their use is mainly limited to China, but ever growing evidence favored their use increasingly. Despite extensive review of literature, this is the first reported use of HA230 cartridge for glyphosate poisoning as per our knowledge, and it had done wonderful, excellent outcome. So take home message: our patient presented with acute condition with multisystemic involvement. Her condition was potentially fatal without any improvement initially, as we had discussed. At that point, we decided to undertake a first of its kind approach with CRRT using HA230 Haemoadsorption cartridge for glyphosate poisoning. She improved and recovered dramatically in the next 48 hours, and even was surprising that she was discharged in the next 3 days and was taking after taking all the supports off in the next 2 days. Rather, she was taken off all supports within 48 hours and was discharged in another day. Our final take-home message is further studies or reports need to be done before coming to a definitive conclusion for the efficacy of 213 glyphosate poisoning. The overwhelming positive evidence in our case should encourage clinicians and intensivists around the world to use HA230 more and more and in glyphosate poisoning. Also, it has been used in very effectively in other poisonings like paraquat and organophosphate. So their use should be increased. So its use must be increased and must be available and must be made available to the general population, because the science is evolving and we can only support what the science we can only support and follow what the science says us to do. So thank you all, and hope you had an uh, uh, good exposure from our side that we wanted to tell you. Thank you.